Hello, dear friends. Welcome to Aspire32 once again. And today we are coming out with another podcast. This is also a very interesting podcast, and I'm sure that all of my viewers who plan for going abroad, especially in United States, will be benefited with this podcast. And that's because this podcast is on residency, for which you may not find a lot of information unless you know someone personally. And I am lucky to know one such kind of a person, that is Dr. Ankita Katpalia, who is a DDS and currently practicing as a dentist in Cleveland. She finished her MDS in India along with me in College of Dental Sciences in MDS Endodontics and Conservative Dentistry. And then she did a residency, and then she's working as a practitioner in USA. So welcome to Dr. Ankita Katpalia to this podcast.
First of all, thank you for giving me this opportunity to talk to you. And it's really appreciative of what you're doing for the budding and practicing dentists in India. So kudos to you, Suresh.
Thank you, Ankita. Well, let us directly come to today's podcast. And I want you to tell the viewers that what is the difference between the residency and the DDS program for international students, or maybe for someone who is doing dentistry in United States.
If I put it basically, DDS would be same as BDS in India, and residency would be same as MDS in India. So for a foreign trained dentist from India, if they want to come and practice in the United States, there are two pathways. One would be the DDS pathway, which is very well known. People are aware of it. And it is same as dental school, and it gives you a degree of DDS when you graduate, same as BDS when you finish your dental school in India. Whereas residency would be that you specialize in one particular subject. It could be one of the well-known specialties or general dentistry specialty, residency as well. So this is the basic difference between the two.
Okay, so you have done a residency program. Which residency have you done?
I did general practice residency. It is commonly called as a GPR. And so there are actually 9 specialties, residencies that are recognized by ADA: your orthodontics, periodontics, prosthodontics, oral and maxillofacial surgery, then your oral maxillofacial pathology, medicine, radiology. In addition to these specialties, there are 2 other residency that are available. That is called as GPR, the one that I did, general practice residency, and the other is called as advanced education in general dentistry, so AAGD. So these are the 11 options for residencies in United States.
It is like you are specializing in one branch of dentistry. But in India, we also have something called as a master's in dentistry, right? So are you saying that the residency is similar to master's, or do you have a separate master's in United States?
So these residencies are same as, so if you are a dental student in US, you would complete your DDS here and then go on to do one of these masters. And as a foreign trained dentist, we can actually apply to one of these masters directly without going through the dental school route.
So what you're saying is, suppose somebody wants to practice as a dentist in United States, you can directly apply into these residency courses. You don't have to do that advanced standing program, which generally we call it as a DDS. And directly you can get a license to practice.
Yes. So you skip your dental school, you do these residencies directly, apply for the licensure exam, and then start practicing as a dentist.
So you have a licensure exam here.
Yes.
Is it very similar to the exam what we have in Canada, which is generally 3 exams?
So anybody, American graduate or a foreign trained dentist, have to take these licensure exams after they complete their schools or residencies before they can start practicing. Usually these exams are two two components. One is a theory exam, that's an online exam, usually multiple choice questions, and a practical based exam. So these licensure exams are a little different here. Depends on what area of the country you want to practice, you take a different kind of exam. Very similar, but anybody who wants to practice dentistry in United States has to take these licensure exams.
Most of the viewers don't know that when I plan to give my NBD, it is Dr. Ankita who inspired me, and she told me that I should try for it. And during that time, I had some information that although there are multiple types of residencies, like what you said, you can do it in endo, you can do it in implants, but there is a rule that if you want to practice by doing residency, you have to do a residency which is of minimum 2 years. This is what is my understanding. Is it right?
So only state that allows you to practice after 1 year of residency is Virginia. In almost all other states, you have to do some kind of residency that is more than 2 years.
So majority of the states in United States expect you to do a 2 year residency program without which you will not be able to get a license. I believe that a student can apply and do a 1 year residency program, any international student, but that will not allow you to practice in most of the states.
Yeah. So even with residency, there's a restriction on the number of states you can practice. So the reason why DDS or doing the advanced standing program is well known and important is because if you do an advanced standing program, get your DDS, you can practice in any state of the country. But if you do residency, there are certain states that will allow you to practice. So that is a major limitation that comes with doing residency.
I wanted to know another one important point is that in residency, you have a specialization. And in DDS, it is maybe a general course where you are learning everything. Does that mean that you tend to get more patients, you practice more clinical work in residency than the DDS program?
I am not very sure about how the DDS training goes, but in residency, these are very highly clinically oriented programs. So yes, I think the amount of patient exposure in residency would definitely be more than in the dental school.
Why I'm asking this is that I have read on the internet that many students after completing DDS, they get into residency programs, maybe an international student or someone who is already in the United States. They get into residency programs to learn more, to get more clinical experience. It is not necessary that only the international students go to the residency program. Even someone who has done a DDS also gets into this, and most of the information says that it is because they want to get more clinical experience.
Yes. So, like an American graduate would want to do, if they want to just get a clinical experience, would want to do a GPR or a general practice residency for a year, get a good clinical hands-on experience, and then go into a private practice. But then there are dental students who want to specialize in specific areas, and they would rather choose to do one of the specialty residencies and then go on to their practice. And these residencies are highly competitive because the amount of seats are very limited. And as a foreign graduate, you are actually competing with American graduates.
You mentioned that there is general practice residency, there is AGED program. This appears to be different than the conventional endodontics, orthodontic residency. What is difference between these two programs compared to the other branches what we have?
So these, the general practice and the AEGD focus more on general dentistry rather than specializing on any of these specialities. The GPR or the general practice residency is usually based in a hospital setting. And the main aim of doing that training is that you learn to manage medically compromised patients, you learn to treat patients in the operating room, so that kind of complex treatments. And AEGD is usually in the dental school or a university program. So again, general dentistry, but a little more focus on didactics as well.
You said that you can practice in limited states. Do you have any rough idea that how many states allows you to practice after residency program?
So I would say around 10 or 12. So again, it is a little more complex again here because some states let you practice if you do a general practice residency and not a specialist residencies, and some states let you practice if you do a specialist residency and not a general practice. I don't know if you got my point.
I
Like,
actually I did
so
not understand it. Can you tell it again?
yeah. So say I'm in Ohio. So in Ohio, you can practice after 2 years of GPR or AEGD training, but not if you did a specialty training like ortho or perio or prostho. But in
Okay,
the state of
what you're saying is if you do a endodontic residency, you can't practice.
in Ohio,
You can't practice in Ohio.
it's in Ohio, but you can practice if you do GPR or AEGD.
I do request my viewers that although Dr. Ankita found recent information, but I do request all of you guys that you should visit the respective dental boards and find more information because the rules keep on changing. So, Dr. Ankita, when you say that an international student can get into residency, it is highly competitive. Is it only depending on the CV or there are fees which are different? Do you have any residency courses which are free compared to, of course, because we all know that the DDS program, that is the advanced standing program, is very expensive. Does the residency program also has a fee?
So the residency, usually the specialty trainings have a fee that can range from 20,000 to maybe 100,000 a year. But there are residency programs, especially the GPR, AEGD, and especially the pediatric dentistry here, because it is usually based in hospitals. Those residencies do provide some stipend, and the fee may be there, or even if it's there, it's usually less than the other specialities. So it's very variable. The length of residencies and the fee and the stipend involved is very variable. But most of the hospital based residencies, the GPR, pediatric dentistry, oral maxillofacial surgery, would have some kind of stipend associated with them. But the ones that are in the universities and the dental schools usually have a fee with minimal or no stipend.
How much is the stipend generally for residency?
Could range from around 5,000 a month to 50,000 a month.
You did say that it is highly competitive. What is the most important thing these dental schools generally look for in a applicant for that residency program?
So I think the major thing that they look for is, have you done something different or something unusual from what you were supposed to do in your training? So not necessarily, but a person who's done MDS in India would have an edge over a BDS, definitely. If you have more research or publications, that would definitely be an added advantage. Community service is given a very high importance in this country. So all these things definitely add to your resume. There is something called as fellowship here in this country that is not very well known, but is very helpful or has been helpful to a lot of people to get into residency. So what is fellowship is, say you are a foreign graduate, you come to United States, you can do a training that can range from 6 months to 1 year here. That gives you little or limited patient exposure, but you participate in a lot of their didactic activities like their lectures, journal clubs, presentations. You get to observe the patients. So get to know the system. You learn new things while you're there. And you actually, the department or the program knows you as well. So it is not something that will ensure your admission in residency, but it is a good learning process. At least if you do a good job during your fellowship, you can get good American letter of recommendations, and that are very important part of your application. So there is a fee involved for fellowship again, and it could be again 20,000, 50,000 a year. But a lot of people who have done fellowships have gotten into specialty residencies here in this country.
The next question would be, suppose someone does the GPR or AGED, they are more into general practice. Can you again
Yes.
do specialization? Suppose if I do a general practice residency and then I feel that I should excel in the endodontics, what is the, or any other branch, what is the further route? Is there another step ahead?
So the process stays the same. You can definitely do it. So the first thing, yes, you can definitely do it. You can do as many residencies as you want to after you finish one. And so the good thing would be if you've done one residency, you get into the system, you explore your interests, you can work on your profiles and go into more higher competitive residencies.
Since you have mentioned the process, generally we know that the DDS program, the process is in a capid cycle. Is it the same? Is it the same organization which, or the authority which also standardizes the admission process in the residency program?
So it is the same organization, the ADEA. Instead of CAPIT, it's a different portal, though it is called as ADEA Pass. So the process would be again same. You apply for your evaluation, take your national boards and TOEFL exam, which is basic. But then depending on the university or the program you're applying and depending on the subjects, you might have to take some additional tests like an ADAT, Advanced Dental Admission Test, and even GRE. So, and then get your letter of recommendations and apply. The selection is through a matching service where you put your rank order list after your interviews. The programs rank their candidates and then you get selected. There are some programs like endodontics does not participate in match, but then for them it's like you interview and then you get an acceptance or a rejection.
How long this process generally does take? We know that for a DDS admission, that is the advanced standing program for international students, it may vary from 1 year to 2 years depending on the resume. But the process itself is minimum 1 year, because every year I believe it starts in March and then you have to apply.
I think it would be very similar to what it takes for dental school. The application for PASS usually opens in May, and most of the match results are out by end of January.
Now, there is, of course, when you are an international student, I do believe that the visa is a big issue. You know, when you think of getting admission in international platforms, and since you said that many students can compete in residency, whether an international student or a student who is already done DDS, who already has a visa. Which visa generally you have to have if you want to get into the residency program?
So if you do a university-based residency that you're not paid any stipend, then you're usually on an F1 visa. That's the visa most of the time you get for your dental school as well. Like your endo, perio, ortho kind of residency would usually be on F1. But if you do a residency that's based in a hospital, like your GPR or pediatric dentistry or oral and maxillofacial surgery, then it is possible for you to actually get a J1 or an H1B visa, which are work visas, because they involve some kind of stipend usually.
So this H1B visa has to be sponsored by the organization where you have got
yes.
the job.
Yes.
Is it very easy? Like I really don't know whether they would prefer to process your H1B, maybe, or rather than someone who already has a visa. Do they have an upper edge there?
There might be a little preference because of the cost involved and the process, but like the program I did my residency from easily sponsored H1B for all the candidates who needed it without any issues. So my personal experience in general for residency wasn't very difficult in terms of visa or the learning process. So,
and that's the reason we planned this podcast, because you have personally gone through this process after your post graduation in India. And today you have mentioned that what are the most important points which one has to know if somebody plans of doing residency, which is an alternative to the DDS program, and although you did mention that it is highly competitive compared to the advanced standing program, because we all know that the advanced standing program is specially carved out for the international students, whereas the residency, all the students can compete, so it becomes competitive. And I'm thankful for mentioning all this information. If viewers, if you have any questions, you can also always mention in the comment section, and I'm sure that I will get some more information for you. Dr. Ankita, now because we have to conclude this podcast, do you want to add some points to this which we may have missed?
So the only thing is, I would say each state in the United States has its own requirements for licensure. So if you're planning to come to a particular state, please read their website. It very clearly states what would their requirements be before you choose the course that you want to enroll into. But if you do not have any preference for the state or do not mind a little restrictions in your practice, residency, although competitive, but is a good option that can definitely be considered, especially if you have a master's in your country, or if you have something specific in your profile, you will definitely be a good candidate for one of these residencies here.
Thank you so much, Dr. Ankita, for giving all this information. My dear viewers, if you found this podcast helpful, please click the like button and subscribe to our channel, and share this video with your friends who might find it useful if they are planning for the dentistry abroad. I will see you once again with one more podcast very soon on Aspire 32. Bye for now.